Hello, this is Matas Yao. You're watching Taped with Rabbi Doug.
We're gonna see Rabbi Doug. We're gonna see Rabbi Doug. We're gonna see Rabbi Doug on your TV tonight. But Daddy, I want to watch Monday Night Football.
Forget about Monday Night Football. There's no other thing we're going to watch on Monday but Rabbi Doug.
Yeah, Rabbi Doug on TV tonight. We're going to see Rabbi Doug. Oh, everybody talk about Doug.
Shalom and welcome to Taped with Rabbi Doug. Glad you could be with us. My guest today is Dr. Mitchell Honig from Los Angeles, California.
North Hollywood, actually.
Yes, from North Hollywood, which is in Los Angeles, California. And Dr. Honig is a dental practitioner, a general practitioner in dental
That's right.
in dentistry, and he is in the Chicago area right now for the American Dental Association convention, which is taking place at McCormick Place. And welcome to the show, Dr. Honig.
It's a
Glad
pleasure.
you could be with us.
Thank you. It's a pleasure to be here.
Dr. Honig has been in the profession for a number of years, and dentistry is a little bit different everywhere you go, but I think there's similarities, as you've mentioned. And the reason I asked you on the show is because our audience will soon find out that you're also an ordained rabbi and observant, and I think that it's an interesting thing to have someone who's in the medical profession outside of doctors, medical doctors who are always looking for different things, but outside of the medical doctor field, to be a rabbi and a practitioner such as a dentist or an ophthalmologist or optometrist. You have emergencies just like a medical doctor would, that would get in the place of the Sabbath, and you'd have to do things a little bit differently than someone else would, who would, of course, immediately answer the phone when it rings and say, how can I help you? Meet me at the office. Can you tell me, do you often get emergency calls on the Sabbath that you yourself have to fulfill, taking care of your patients?
Well, thank you for asking that. That's a very good question. Generally speaking, that does happen, but thank God it doesn't happen too often. And I say thank God because it's always the Sabbath is a very sacred, as you know, is very sacred to us. And the very act of answering the phone or doing any kind of malacha on Shabbos is really something that we have to understand that it's not a simple thing. The Ramban is supposed to have said that you have a special pasuk that matters pekuach nefesh by,
which is a verse which allows you to save people's lives.
We have a verse that allows us to save people's lives, and but without that verse, then it would be that we would have to give our life for the Sabbath. And the mindset is that the Sabbath is, if it wasn't for the fact that we hold life more precious, but the Sabbath, if it wasn't for that special verse that would say to us that life is so precious that that it supersedes Sabbath, we would say the Sabbath is more precious than life, and that's the mindset. So, yes, we have emergencies just like any other doctor. Sometimes they can be life-threatening, and if we don't intervene in some way, then they can be very serious. And it's happened in practice. So yes, I've had to intervene, and most of the time they involve telephone calls. We get them to the hospital or some way, but it doesn't happen too often in dental practice.
Tell me, you, for example, write prescriptions for people after doing surgeries, after to prevent infections, for pain, and so on and so forth. When you do this, is there any concern whether a medication is kosher for an observant patient who would keep kosher? For our audience who might not be aware of these things, would it matter? Would you have to check into the ingredients as a doctor before you prescribe something to someone who kept kosher, whether that ingredient or that medicine would be kosher? I, of course, know the answer to this, but I think you, as the medical professional, could you explain to our audience how that would work, or what would be and wouldn't be allowed?
Well, I would I would preface that in saying I would hope that people would contact a rabbinical authority, their rabbinical authority. And as a practitioner, my obligation obviously is for the to do what's within the standard of care. And kosherism are really issues that we're sensitive with, but they really have to be dealt with as a separate issue. Saying that, in most situations where you have a matter of life-threatening illness, obviously the kosher is really not an issue. Just like the Sabbath is not an issue, but the kosher is not an issue either. When you have a situation where the medications, we do have alternatives for the most part because it's they really are not any very serious questions because they're really not any questionable ingredients in these medications. There's one notable exception, which was a problem in Los Angeles until they started fluoridating the water. The water is not fluoridated, so it's really a moot point. But we used to give medication. We used to give vitamins with fluoride. Now, because vitamins have are things that you can eat, so they really have to have a reliable hashgacha.
So it's a different status than a pill, for example, you would swallow that has no flavor, and you would just swallow with water to make you better. But this has flavor and so.
This is a chewable, right? So it's something you eat, and it's a chewable thing. So it has to have a type of hashgacha, so rabbinical supervision. So fortunately, there is one brand out there that had, at least at that time, it had rabbinical supervision. Sad to say that it lost the rabbinical supervision, but that was coincident with the
fluoridation of the water.
So I think that God has been watching the residents of Los Angeles, so they haven't had that issue has not really come up. So,
interesting. Very interesting. Yeah. You used to live here in Highland Park at one time here in the Chicago area.
That's correct.
And you've been in Los Angeles now for a number of years. When you practiced dentistry in the Chicago area, did you find that the people you worked with practice dentistry differently here in the Midwest or in the Chicago area than they do on the West Coast? Are there different practices? Different, you have to obviously take bars in different states and different practices. Are the requirements different? The bars different in each different state?
There are different requirements, but I should hope that they don't practice much differently.
Okay.
The standards are pretty much the same. I mean, the practice throughout the country. I mean, there may be some regional differences, but dentistry is dentistry, and you have. I would say pretty much the same. Mm-hmm. And I hope your residents of Chicago don't take it personally that I went to Los Angeles.
Tell me a little bit more about the taking care of teeth and kosher, because this is something that I know comes up. Questions come to me all the time. For example, is this toothpaste have any ingredients in it that's not kosher? Does this product that I'm using in my mouth for a mouthwash or for a pre-rinse have a problem with it? Is it a problem when you're not swallowing it and actually eating it and spitting it out like we do with most dental care products? Would keep being kosher and the ingredients have an issue rabbinically in the dental?
Again, one should really check with the local rabbinic authority, and that's not really my domain. But I will say this: most of the toothpaste, most of the toothpastes are not what we say is roy lefilo, which means they're not things that one eats or mouthwashes either, are not things that one swallows or consumes in any way. So generally speaking, even though there are some ingredients that may be questionable, for example, glycerin is a product that is often in toothpaste
and often not kosher,
and often not kosher. Yet is generally recognized as a product that's not a problem, and the reason being because it's not something that a person would generally consider a food item. So therefore, they're generally accepted for most rabbinic authorities that want to use most toothpaste on the market.
Wonderful, wonderful.
But there are, I mean, I should say that there are toothpaste that do have special hashgacha, special rabbinic supervision, that one may...
People can take that extra step to be more strict about it.
One wants to be more strict, and one can. They're available while they're out there. So.
Right. And I won't even go into the Passover story because everything changes at Passover time, of course. But let's talk about dentistry in general. What's out there today in the dentistry field? Because a lot of people are very health conscious today, more than they were maybe 20, 30 years ago. What's out there in the dentistry field, do you think, that's really innovative products, things that you can get from maybe just a dentist even, or even on the market itself, that really you think as a professional dentist and doctor that would benefit people that maybe they aren't aware of or haven't really looked into deeper than just seeing a commercial or an ad for in a magazine?
Well, there's one product which is very popular, especially in my neighborhood, and where I service more or less the Hollywood crowd, and they're very aesthetically oriented. Bleaching is very, very popular with them. Bleaching is a process, very safe. It's the best way to do it, I have to say, is to get it from the dentist, although you can buy it over the counter. I don't recommend most of those over the counter products, not because we're trying to service our profession, but because they have certain ingredients that I think are not that can be
questionable in their quality?
Questionable in their quality and their safety and their efficacy. Sort of like having rabbinic supervision, you want the dental supervision. You want to know somebody. You want to rely on somebody you can trust, and that's basically what your dental professional is for. Someone you can trust. So bleaching is a very good procedure. I don't know how popular it is out in Chicago, but everybody in Los Angeles has white teeth.
All right, and I see yours are too. So you've been doing a good job. Interesting. Bleaching, I think you hear a lot about it. You hear radio ads. You see in the magazines. You see that. So I think it's popular in the Midwest as well. It's something new. Do these toothpastes that say they have, I don't know if they're abrasives or what they are, whitening ingredients that help whiten your teeth, do they really help, do you think, as a professional? And
Well, the ones, it's very interesting that you say that, because one of the active ingredients in some of the over-the-counter materials is titanium dioxide. You'll be familiar with titanium dioxide because that's the active ingredient in such products such as Whitening and whiteout. So this is true. So that's one of the things that you have to watch out for, because some of the cosmetic changes are really bad. They're just temporary cosmetic changes. But the real bleaching products, the ones that we gently recommend, have a product called carbonate peroxide, which is a form of hydrogen peroxide that releases hydrogen peroxide, and that has it's efficacious, it's safe, but again, it should be done through the supervision of the dentist.
The bleaching that's done by a dentist, and I've heard one commercial I've heard on the radio, for example, said 8 shades whiter when we're through applying our gels and doing our whitening process for you, and so on. Does this mean if someone has really brown teeth because they smoked for 30 years, or they're big coffee drinkers, and it's really done a job on staining their teeth, that you can actually bring their teeth back to an almost white shade, or the 8 shade idea? Is that really possible?
In many cases, that is possible, but it has to be done, again, it has to be supervised, because a lot of these things have to be removed professionally before you bleach. And just getting an over-counter product won't be efficacious. So again, that just corroborates what we were saying all along. That things have to be done through a dental professional.
Okay, you're visiting back your old Chicago area from friends this week, but you really came here to the ADA convention, which is taking place in McCormick Place in Chicago. Can you tell me a little bit? I know you traveled to Hawaii and other places, San Francisco and places to attend this convention. What's the benefit of this convention, and what does it really take place on an annual basis for? What do the dentists come here for?
It's really an international convention, and it's really here to, it's a showcase of all the new things and all the new ideas that are out there in our profession. And in order for us to keep in touch with all the new things, to be in line with all the new inventions, we have to attend these things, and it's kind of a marketplace for the exchange of new ideas and new concepts. And so that's why it's so exciting. That's why we're here.
So do dentists who invent new things or come up with new ideas have booths at these conventions that you actually visit, or are they actual companies that are manufacturing things for dentists? Tell me a little bit about what you see when you're there.
Well, it's both, a little bit of both. You have large companies that innovate, and then you have some people who are on a more smaller basis come out and they invent their own products.
As individuals.
Yeah. So you have a little bit of both in this forum.
And is there any teaching or any classes or anything that go on at these seminars?
There's seminars, sure. I mean, there are hours and hours of seminars.
So there's a lot to learn for a dentist who's in the profession.
It's a lot to learn.
Now, can a dentist, for example, come into one of these conventions each year and directly buy a product there, or do you have to find your distributor after you go back to your office when you get back?
You could buy products there. You could buy the latest and greatest, and usually they have they give you incentives for buying at the convention. They want you to buy all sorts of new gadgets and gizmos that do this and promise this, and a lot of them are very good. I mean, a lot of very good new things out there that are just fantastic.
Let me ask you something else. As a professional dentist and doctor, I presume there are methods and ways that you as an examiner do things. Something that I think I've noticed in the dentistry that I've observed over the past years is that the taking of X-rays has become less and less by dentists, possibly because of the ideas of the dangers of radiation or so on and so forth. But I remember as a child that every other dentist appointment, once a year, I was getting X-rays from my dentist. And I've spoken to other people and seen that they don't get those X-rays as often. As you as a professional, how often do you give your patients who come every 6 months for their cleaning and checkups, how often do you give them X-rays, and when do you recommend that X-rays should be taken when someone would ask you a question like this?
Well, we based it on American Dental Association guidelines, and these guidelines are pretty much well known and published, and based on that, I don't think there's been much of a change there. X-rays are our window to. I just want to make that very clear. X-rays, the amount of radiation that you're getting from X-rays of full mass series probably equal the amount of radiation that you get. Let's say if you go up in an airplane and you're taking a 5 or 6 hour flight, it's probably pretty much the same. Maybe it's a different type of radiation, but really we try to eliminate, or we try to, I should say, minimize the amount of radiation.
I can just mention that maybe about 10 years ago, my dentist started using the where he didn't when I was young, started using the lead jacket that they put on your chest.
Right.
And I remember when I was young, they didn't do that. So I think that was a standard that was raised as well to prevent that.
That's right. That's very important to do. There's certain film which is much faster. The film that we have is much faster. We have there's certain technologies that use computers that also speed up the film, and in that way it cuts the amount of radiation that's actually delivered. So there are many ways in which the radiation can be minimized. So saying that, I think the standard still is and should be at least once a year. I think it has to be done on a case-to-case basis, and I think it's inappropriate to make a standard based on a general standard. Every case has to be based on the kind of risk that you're doing. An X-ray is a diagnostic tool, and as like any other diagnostic tool, it has to be used properly. It can be overused, and it can be there's just as much of a danger as underusing a diagnostic tool. So I don't think anybody would want a root canal without an X-ray, because it would be like working with your eyes closed. So these are our eyes in which we can see the world. We can see the oral cavity. This is the way we open our eyes, and this is the way we look and make a good diagnostic decision.
So, as with anything, the benefits outweigh the dangers.
Well, I think
using
so.
X-rays once a year.
It has to be done by a practitioner. The practitioner has to make, a decision based on the relative risks and the relative benefits.
Another question: does a dentist fill a cavity from surface and site-seeing without taking the X-ray to see how deep it is beforehand? I don't know. I'm asking the question out of ignorance for that.
Well, again, the sight and we use our senses. In other words, we do what we call a clinical examination. We can see physically if there's a cavity. The X-rays are also an aid to it. So between the two.
So generally, my question is: does a dentist generally drill without looking at an X-ray first when they suspect that what they're seeing is a cavity?
To use a metaphor,
okay.
To use an analogy, it's just like if you were driving and you sometimes you look out the window and sometimes you use your rear view mirror. If you're asking how much time when you drive, do you look out your window or do you use your rear view mirror? It depends on the situation. Sometimes you have to look to the rear. Sometimes you have to look directly. These are all aids that you use, and they help you hopefully to prevent an untoward reaction, so to speak. So the same thing with an X-ray. An X-ray is a tool. It helps us to see. It helps us to understand what's going on, and it's like a rear view mirror. It helps us to see if there's something we need to avoid.
So you're saying with your metaphor that generally you use that X-ray when you suspect that there's something there.
That's correct.
That's good to know. It's good to know, I got to tell you. I think that people are scared of dentists in general. I think that there's a general fear of the public of dentistry, of dentists, and fear of pain and stuff like that. Do you still use, or do you use gas with people instead of Novocaine, for example, when working on their teeth and drilling? Are there people still nowadays, dentists who use, or people who request that they rather have gas than that Novocaine drilling?
Absolutely. Usually we use it as an adjunct to local anesthetic. But yes,
I know that I had a few cavities when I was younger, and I was always afraid of the Novocaine. I actually only used gas at the time, and never had drilling with Novocaine. I was able to deal with it. It wasn't, so painful that I wasn't able to deal with it. And I thought, from seeing the size of the needle from the Novocaine, that it'd probably be less painful in the long run.
I have to say that we have there's a new technology out. It's called microabrasion, and many dentists are using that. So the nice
How does
thing,
that work?
Well, it actually uses these little particles, luminous oxide particles, that actually abrade a cavity or abrade the enamel surface. And
like a sandblaster?
Like something like a sandblaster, yeah. Something like a sandblaster, but it does it in such a way that it's very kind to the tooth. And in many cases, can be used with, you can
avoid drilling?
Avoid a local anesthetic. It can be used very comfortably. But we sometimes use it in conjunction with a local anesthetic because it makes it much more comfortable. But in a lot of cases, people who have that concern are benefited from this procedure. So in many cases, that we can do that. And dentistry is always coming out and seeking new ways because we are very aware of these concerns that people have. Because everybody's fearful of the dentist. I'm fearful of the dentist. To admit,
How does a dentist choose a dentist?
I'm fearful of my rabbi too.
How do you choose a dentist? Do you find a colleague that you work with that you trust?
Well, hopefully they'll get a recommendation. They'll come to my office. That's how they choose. How does one choose a dentist? It's a good question. I think the good start would be with the American Dental Association. I don't know if this is a commercial. This is for the American Dental Association.
A recommendation.
But that's what's really.
And even dentists who choose their own dentists would look in that way?
From other. I think the best referral is, of course, through the other professional recommendation, because other professionals know other professionals, and it's a little better than your next door neighbor. But I mean, I I would say the same way anybody would, you would find a good, any professional use the same tools to find a dentist.
Now, I'll give you an example. My dentist here in Chicago does not practice pediatrics. He does not work with young children. He works with children, I believe, above 7 years old, or whatever his practice is and his comfort level is. But is there actually a special? I know you do pediatrics. Is there a special certification for someone to do pediatrics?
Your kids are so sweet.
Is there a special certification for someone to do pediatrics, or is dentistry when you get your dentistry degree?
There is a special. They recognize specialty of pediatric dentistry. They typically have another 2 years of formal education. And they're trained specifically in the nuances in pediatric dentistry.
Do you, as a dentist, on the subject of children, do you recommend, if there's a full-fledged cavity in a baby tooth, filling it? Because I've heard different dentists say, well, the baby tooth is going to fall out. It won't affect the next tooth coming in. Why drill into the baby tooth? And then I've heard other people say that, you'll save that baby tooth until the time it's ready to fall out, which could be years ahead of now, rather than, letting it go. What is your recommendation in general?
Well,
obviously, there are specific cases that would change your recommendation.
Basically, the truth lies within both statements. I mean, there are situations, but I think they're limited, but where you would just let the tooth, we call it exfoliate, and just come out by itself. But that's limited to those cases where you feel very strongly that there would be no repercussions by doing that. But yes, many times we decide just leave it alone, it'll come out by itself, and there'll be no reason to treat the tooth. But generally speaking, it's very important to treat teeth in the pediatric teeth, teeth in children. And the reason they're going to fall out, the reason for that is very simple, because you're avoiding abscesses, you're avoiding pain in the child, you're avoiding extractions, which can be a very traumatic experience for a child. Most importantly, the primary teeth are designed to maintain the space for the permanent teeth to come in. If they're removed prematurely, you can often create a situation where the permanent teeth don't come in the proper sequence or in the proper location, and that can create
braces, orthodontics.
That can create an orthodontic situation. So that's why we treat it.
Okay, and another question. I know this comes up, especially for people who have children. My child's tooth has been loose for a week already, and it's not falling out. I want to tie that thread around it and pull it out, or I want to grab that pliers and pull that tooth out already. Do you recommend pulling teeth, or just waiting for that last moment for it to hang there until it falls out? What is really the safest and the best method when someone's got that long-term loose tooth on their children? People always ask this question.
Whether they should pull it out or... it reminds me of an extreme example I heard on the radio just a couple of months ago. Somebody had a toothache, and they just didn't want to go to the dentist, so they used a shotgun to try to... So, I mean, we all have our extreme methods of dealing with this kind of problem, but generally speaking, I think the best, obviously, getting professional advice is the way to go, just like anything else. If you do it yourself, it's going to really cost you at the end, so you're better off seeking professional advice. And of course, it's up to each practitioner to determine whether or not it's a plum ready for picking or not.
Dr. Honig, I can't thank you enough for being on the show today. You've shared a wealth of information with our viewers, and you've been a pleasure to have on. You have a wealth of information. I hope next time you're in town, we can have you on again possibly, or maybe one day we'll come out to you and catch you in action and kind of explain a little bit more in detail about how dentistry works. I want to thank you again for being on the show. I hope that the convention brings you much satisfaction and knowledge, and for all the dentists who are here in the Chicago area. Remember, we're on every week at this time, and I want to thank you, our audience, for being with us, and hope to see you next week on Taped with Rabbi Doug. My guest today, Dr. Mitchell Honig from North Hollywood, California, from LA, and hope to see you next week. Shalom.
Bereshis Noach lecha vayerach Chai Sarah told us. Vayitze vayishlach vayeshem. V'getz vayigash vayechi yayay shemos. Vayirabo b'shalach Yisrael. Mishpatim teruma tetzava. Kisiza vayakab v'kudei. Vayipratzav shemini tazriya. Mitzorach haremos. Kedoshim amor behar. V'chukos hayayay b'midbar naso v'halos shlach korach. Chugaz bola pinchas matos mazeh. Devarim v'eschananei gavrei shovtim. Kisei kisavonim savim v'yachazin es habracha.